Good afternoon. I'm Dr. Amy Lopez, and I'm here to talk about safe transitioning. Safe transitioning is a matter of choice and perspective. We set our goals and we try to achieve those goals in transitioning by ourselves or with guidance from friends and professionals. But the moment we decide on our goals and take the first few steps, we are set for life. Of course, there will be setbacks, insecurities, and obstacles that we will need to hurdle, but we will do them anyways. First advice, ideally, would be do not pop pills on your own. We should consult medical practitioners, but there's not a lot out there, particularly in the past decade. And at the moment, only a few of us obstetrician gynecologists and endocrinologists take in patients for transitioning. And when I say few, you can count us with your two hands. Second advice is to be aware of your goals. How far do you want to go in medical transitioning? Remember that this will be another puberty for those who decide late in their years. Are you ready to develop the significant changes in your body? For trans women, around their face, a wider hips, more developed female breasts. For trans men, body hair growth, including facial hairs, broader shoulders, and deeper voice. Why do we want to set our goals? Because later in your transitioning, you might realize that you do not want the entire package of changes, but we cannot choose which one we can only have. And the option would be surgical intervention. Third advice would be to understand what hormones are in effect during your transitioning period so that you will be able to appreciate the monitoring of the blood levels. The goals of hormone intake for trans women would be to lower the testosterone with the use of anti-androgens, plus increase the estrogen in order to reach the levels of that of cis women. And then we can monitor the changes as we go along the transitioning. For trans men, we do a similar monitoring in order to reach the levels found in cisgender men. And then we monitor the effects such as the decrease in pitch of voice, facial hair growth, and increase in muscle mass. But sometimes patients will note favorable results already, even with lower levels of blood hormones, and vice versa. Fourth advice is that there are only a few recommended hormone forms being used, and in our country, there are only a few that are available and allowed to be in the market. Deviations from this would need close monitoring. For trans women, the estradiol form is recommended, ideally the transdermal route. The intramuscular route is also advisable over the oral route, but the transdermal and intramuscular estradiol are not available in our country. Only the oral form is. As, as for the anti-androgen, there are only two forms available, our cyproterone and spironolactone. Cyproterone is not um, legal for use in the United States. So if you read recommendations for coming from the United States, they will only suggest spironolactone. Some centers would also use gonadotropin releasing hormones, which can also block um, androgen secretion. Now, for trans men, there are counterpart transdermal preparations of testosterone and intramuscular preparations as well. These are also not approved for use in our country. And unfortunately, there are no oral preparations of testosterone available. My last advice would be about the effect of hormonal transitioning to that of aging in both trans men and trans women. Mainly, we should prepare for the development of osteoporosis, cardiovascular diseases, as well as monitoring of prostate and breast diseases. Osteoporosis is a major concern, primarily in aging women, those who are already in menopausal stage. However, This is also a major concern for those who are using anti-androgen. Complete block of testosterone effect can markedly accelerate osteoporosis in trans women. Ideally, at the start of hormone use, we encourage intake of calcium, same as we are giving calcium to those women who are near the menopausal stage. Cardiovascular diseases are also accelerated with testosterone decline and estrogen decline. I have to emphasize that the most significantly associated with cardiovascular diseases, which are your heart attack and stroke, is the prolonged use of synthetic estrogen, and um, these are found in our oral contraceptive pills. And then we look into the monitoring of prostate conditions in trans women, as well as breast diseases in both trans women and trans men. The future looks bright for the advancement of trans services in our country. There is now a growing interest in the provision of these medical services as we see gender clinics being set up through specialty society, gradually including these recommendations into the curriculum. Hopefully, collaborative efforts within the medical community towards optimum healthcare for the transgender and non-binary clients continue to progress in our country. Thank you and good afternoon.